is Carmel Hauck. My student number is T00701793. This is Charlie. He is just recovering from a dental procedure, so I'm going to do my passive range of motion on him. He is laying in lateral here, so I'll start with his front leg here. So essentially you just want to kind of keep all of his joints supported and parallel to the bed, and then you're going to help him go through a range of motion, and you want to do the full range of motion from toe all the way up to shoulders. And you can do it like this way, like the slow movements, or you can work each and individual joint on its own and do the tension and flexion as well. So you want to do this 10 to 20 times, and then you're going to reverse and you're going to go the other direction 10 to 20 times as well. And it's the same idea for his back end. So back here, we'll have his limb. Again, you want to support it. You want to make sure it's nice and parallel, and you're basically just going to help him run through the motions there 10 to 20 times, and then reverse 10 to 20 times as well. And same things, you could be massaging the joints, making sure everything's working, flexion, tension, etc. But the main idea is keeping it parallel and supported and doing those full movements with him. Now, he is like fairly awake, but we have him positioned so that if he were to be more comatose or if he was having any issues with fluid, it's built so that there's a roll of towel underneath here, and that's to help kind of avoid having any fluids building up in the tissues or the throats, so that the drainage will help. And we want to keep their body elevated like 15 to 30 degrees above their body, their head level 15 to 30 degrees above their body, and that's to help with the drainage, venous drainage, and also to decrease like intracranial pressure in those patients. So we have that towel rolled up so that he can hold his head up, or he can also drape it over the side. Elevating a head more than 30 degrees is contraindicated in those traumatic brain injury patients, because it can kink things off and block your venous drainage there, and it could potentially block cerebral blood flow completely. So you definitely want to avoid any more than a 30-degree kink in those dogs. Right? He's ready to leave. So now I'm going to cushion him a little bit more. He's already got his little cushion here, and he's got some pillows behind him to help him sit up into sternal if he wants. But I'm going to give him a little bit more of a cushion behind his bum here. And then he's pretty barrel chested, so I'm going to take this blanket and just help support the keel under here. Just a good boy. Just help support his keel in between his little shoulders here. You want to sit up, don't you? Just going to put that underneath his shoulders so that there's no pressure points that are sitting on the kennel floor. He already has a nice big pad underneath him. And then I'm just going to go under here and support in his hind end too. So now he's nice and cushy and padded. We'll tuck him in, keep his toes warm. And he's all cushy and padded until he is moving on his own and he can stand up. So it's super important to keep them cushioned and comfy, especially in those points or the downside. They shouldn't stay in this specific position for more than 4 to 6 hours. You want to rotate them often. This is to avoid atelectasis or like muscle tissue joint fatigue. If they're pinched in like an uncomfy position, it could lead to like stricture. So you don't want to keep any muscle or joints in any specific position. And then as well, like for the longer term tissue necrosis or the cubital ulcers as well. So those are some of the reasons why padding is super important in the kennels.